Hey guys, it's Miss Turner here. So we're at video number 2 for Foley insertion. So I'm going to walk you through the entire scale. So my hope is that you'll use this video at home and you'll follow along with me. Even though you don't have a mannequin at home, you can follow along the setup and how you would insert the Foley catheter and use this to really assist you in your test out, for your test out that's coming up in a couple of weeks. So again, I have my Foley catheter kit here. I want to make sure I get a kit before I go in the room. I want to make sure that I have a physician's order before I go into the room. And I want to make sure I know why I'm putting this Foley catheter in. Not just that the physician ordered it, but why do we need it? We just talked a lot about Foley catheter associated urinary tract infection. So let's know why we're putting this catheter in. So you can think back to lecture about why we might want to do that. Surgery, anesthesia, urinary retention, prostate issues, maybe some skin issues, I&O for a critical care patient. So any of one of those reasons would be a pretty good valid reason to put in a Foley catheter. I'm going to make sure that I'm going to do my AIDIT, and I'm going to do a lot of explaining to my patient, especially if they've never had a Foley catheter. So we're going to head on into the patient's room. We're back. Hi, Mrs. Smith. I'm Shane. I'm going to be your student nurse today, and the physician actually wants me to place a Foley catheter. So you're having some problems voiding after surgery. So he wants me to put a catheter up into your bladder to help you relieve some of that urine that's in your bladder. Probably going to take me about 10 minutes. Might be a little uncomfortable at times, but I'm going to talk you through it and let you know what I'm doing at all times. I'm going to check your ID band to make sure that you're really Mrs. Smith. Can you tell me your name and date of birth? Excellent. First, I'm going to take a few minutes just to get my Foley catheter set up. I'm going to clean your perineal area. Make sure you're nice and clean before we insert this to decrease the chance of infection. So before you ever get started doing Foley catheter insertion, you absolutely want to make sure that you provide perineal care, especially if they're incontinent. Let's get that area nice and clean, soapy water, washcloths, clean the area, and then you can proceed with your procedure. So I did perineal care for Mrs. Smith, and I'm going to get my Foley catheter kit set up over here. So again, I'm going to open my kit. I'm going to pull the kit out, okay? I'm going to open it away from me, grab from underneath, and open my kit. We need to get her perineal area set up. Remember, if your patient is confused or elderly, you may need to get a couple of people to help you hold legs. You might need someone to get a flashlight to help you find the area, especially in a female. You're going to bend the legs up and out. Our mannequin doesn't do it as well as hopefully your patient will be able to in the clinical setting. We're going to do the best that we can here. Like I said, I already performed my perineal care. So now I have this first drape that I showed you in the last video. I'm going to grab it by the shiny side because that's the side that's going to go down. I'm going to tuck it under here, and I'm going to sneak it right under her buttocks. You can ask them to lift up their buttocks if they can. Otherwise, just get it under there. Again, remember that drapes are primarily used just to help decrease the amount of microorganisms that are present in the general vicinity. Next, I have my sterile gloves, so I'm going to place those on. Might need to refresh on how to do that. You want to make sure that you're not going to open your sterile gloves up onto your Foley catheter kit. Remember all of your rules of a sterile field. You don't reach over it. You don't turn your back on it. The outer 1 inch is not considered sterile. I'm going to put my right glove on first. Grab it by the cuff. Pull it up. I'm going to reach under the cuff of the second glove. Hold your hitchhiker thumb out so you don't contaminate your glove. I'm going to go right up. I can then adjust if I need to. So from this point forward, everything is going to be sterile. I have my second drape I'm going to put on. It's going to go right over the perineal area. And again, remember, these gloves are sterile, so I may just kind of have to drape this on here the best that I can, making sure that I don't touch any of the areas that are not considered sterile. Now I have exposed my perineal area very nicely. Here I'm going to get my Foley kit set up. I already showed you this in video 1, but we'll see it again here. Got my iodine solution here. I'm going to open it. I'm going to put it all over my cotton balls, and I'm going to get rid of the package. I got my specimen cup in my label, so I'm just going to set that aside. I'm going to show you how to get a specimen in the third video. I got my lubrication, so I'm actually going to put that right into the kit. When you're using your kits at home, I don't want you to do this because you'll get your kit all messy. So I got the top part set up. I can set this right to the side. Now I want to prepare my Foley catheter. I'm going to very gently, like I showed you in the first video, take off the bag that's on it. And you see me working my hand up the catheter there and stabilizing it as I'm pulling this bag off. I can set it right down in there. Everything in there is sterile. I want to check my balloon, so I'm going to get my 10 ml syringe here that's filled with sterile water. Hook it up to this port right here, and I can again check my balloon here, like I showed you in the video. Make sure that it's not leaking and that it's inflating properly. And I'm going to deflate the balloon and leave my syringe completely attached right here so that it's ready for me when I go to insert this on my patient. So now I'm ready to move everything to the bedside. I'm going to put my Foley catheter kit, actually I'm going to lubricate before I move to the bedside. I prefer to lubricate while I'm up here and just put the lubricated catheter back in. You're going to lubricate about 2 inches so it's nice and a little more comfortable for your patient. I'm going to move my Foley catheter box here. I'm going to put it right up close to the patient so that when I'm ready to insert, I can have my catheter right there ready to insert. Now I'm going to move my extra lubrication and my cleansing swabs over here as well. At this point, you're ready to designate one hand dirty and one hand sterile. I'm positioned on the right side of the patient because I am right-handed. So I want to make sure that I'm going to have my left hand able to hold the perineal open and clean it, and my right hand is going to do the catheter insertion. Once I put my hand here and I spread the labia and I clean the labia, remember that hand has to stay there, whether you're holding the penis of a man or holding the labia open of a female. Your hand has to stay there and it's considered dirty. Okay? So I'm going to tell my patient, Mrs. Johnson, I'm going to just clean the area. It might be a little bit cold. I'll let you know before I'm going to do the insertion. I'm going to grab one cotton, spread the labia, clean down one side, and then I'm going to drop it right here. I'm not going to put it back on my kit or anything like that. I'm going to put it right there. Grab my second swab. I'm going to go down the other side, put it right there. I'm going to grab the third swab and I'm going to go right down the middle. While I'm doing this, I'm looking to see if I can visualize the urinary meatus, and it might give me a little bit of a hint of where I'm going to go. Now I'm ready to insert. Here I have my catheter. It's all lubricated up. I'm going to make sure I don't contaminate it. I have it in my hand here and in the sterile field. I'm going to go right. Mrs. Johnson, I'm inserting the catheter. It's going to feel a little bit of a pinch. I'm going to insert until I see urine come into my catheter. Remember, for females, it's not going to probably be too far, and for men, it's going to be a little bit longer. So here you can see my urine flow right here. It wouldn't usually go this far into a female before you'd see that. Now I'm going to make sure I insert 1 inch to 2 inches farther so that when I inflate my balloon, it's not in the urethra. Now before I let go of this area right here, I'm going to grab a hold of it with my dirty hand and stabilize that catheter. If I didn't grab a hold of it right there, the catheter is going to start trying to come back out because it doesn't want to be in there. Use my right hand here to inflate the balloon. Once that balloon is inflated, I'm going to check for placement. Lightly tug on it to make sure that balloon is inflated and it's really in there. Take my dirty hand, come over here, and untwist the syringe. Now I have my Foley catheter in the appropriate place. You can see I still have urine flow coming here. I'm going to secure this to the leg of my patient, either via tape or a nice leg strap that you can find on the unit. And I'm going to take this out and hang it on the side of the bed. The last thing that we're going to do is document. So we're going to document when we put it in, what happened when we put it in, did the patient tolerate the procedure okay, what kind of urine did I get back, was it nice clear yellow urine, was it cloudy, was it odorous, did you have difficulty inserting the catheter, and what size catheter you inserted, and that would show you right on the kit that you got. And then you're all set to go. You want to clean your patient up. You want to take down your drapes here. You want to probably have some soap and water handy so that you can clean the betadine and iodine off of your patient as well. Sometimes it can just be a little itchy and irritating to patients, so you want to make sure you clean them up nicely and give them some education about the fact that they have this catheter and now they shouldn't really sense the urge to void. They may occasionally, especially when it's first in there as their sphincter is adjusting to it being in there, but after a while they shouldn't even really be able to really feel it in there. Okay, on to video 3.